this is a good segue. So Will's seen this. You saw this with Dr. Acevedo. You went from open spine surgeon to minimally invasive spine surgeon to, if patients don't know what this is, you are essentially scoping their spine.
Yeah.
And you took this to the next level because we talk about this in the surgeries I do. You see the surgery, you practice, and then you do it on a patient. I've seen where I know what you've done behind the scenes, obviously, because we chat about it all the time. But maybe tell the audience, like, how did you get to this level? Like, it's not everyone can say this is like going from like making cereal to a filet mignon. Like, this is next level stuff. Like, you can't see anything that's going on until you put that scope in. So you're finding it localized. And this incision, this looks massive, but I'm an arthroscopist. So this is my wheelhouse in terms of these scopes. That incision on the screen is like this big. So tell the audience like what it takes to get to this level. So people need to know that, this is not something that just straight over simple, easy to do.
Yeah, no. So, I mean, you have to have a number of skills. And I think, this is where some of my other experience doing trauma, kind of comes in, because a lot of the first portion of your case is localization with an X-ray. And that's something that if you do trauma, you're really comfortable, steering needles, steering, dilators to a specific place using an X-ray and doing it safely, right? And so, the first thing is understanding the anatomy, understanding what you're trying to actually accomplish with your tools so that you can use an X-ray machine to get there safely. And so that's tricky, right? Because you have to find where you make your incision. You have to find the trajectory, and there's a lot of planning and work that goes into it. The patients, get onto the table, and I'm taking X-rays and measuring things and being really careful, and it almost look like a blueprint, because there's so many markings. But that's because I'm trying to make sure that we make one incision, that we're being as minimally invasive, but also as safe as possible in the process. And so, you make an incision, you take X-rays that are, AP, lateral, which are different types of views. You take some oblique views, and you kind of combine them so that you get a sort of a three-dimensional representation of what you're looking at in your mind. And then it just, it's, sports, Grant, it's triangulation and just, kind of having the hands to say, this is the angle that I'm going to go for, and this is where it's at. And so what that took for me was, going to, cadaver courses, and then beyond that, practicing on cadavers and, practicing, in the lab a number of times so that we, so we felt like we were ready for prime time. And so at this point, I've probably done 40, 50 levels in the lab, just making sure that I can, consistently target, that I can consistently get access to the foramen, or consistently get access to the interlaminar space, so that we can be safe and effective.
And I think it's important for people to know, like, this is not a skill that's easy. I every day scope, right? I'm doing 5 scopes, 6 scopes, and you see residents that try to do it, or fellows as they start, and they struggle the triangulation. So Dr. Schaefer went from a spine surgeon. He had the hip arthroscopy skills. He has the skills he learned at HSS. He has this trauma skills, but he had to put all those together to do this. The result is a significant improvement for patients, but also it shows dedication, right? Like, there's a lot of people that don't want to do this. Not only is it challenging to get this product in a surgery center outpatient, which we will talk about in a minute, but on top of that, getting it outpatient and doing it safely and doing it well is no feat. It is very, very challenging. There's no joke here. And the fact that he's able to do it consistently is really impressive. And I think that I really want patients to know about this option, because we've seen it. And this is basically where sports was about probably 15 years ago. And I think that we're literally at the cusp. And I feel like Will and I could have this conversation with you in 2 years, and you'll be like, dude, I'm way beyond that. Like, we're already like on this trajectory. Yeah. And what do you think about endoscopy and spine surgery? And where do you think this is going?